Picture this: a large wood desk in a medical office. A young woman, mid-30s, sits on one side, and on the other side, behind the desk, sits an oncologist, middle-aged, glasses. The doctor says to her, "In order to treat your early-stage cancer, you're going to need to have surgery. This kind of surgery is what we call a skinning procedure, and it can cause disfigurement. And if your cancer ever comes back, we'll need to do the surgery again and remove even more. Do you have any questions?" No, the woman stammers. "Okay, then please see the nurse to schedule your surgery, and I'll see you in the operating room." The young woman picks up her purse, walks down the hall, past the nurse's desk, and does not come back. That patient was me. Picture this: a clinic examination room. A young woman sits in a chair. She sits uncomfortably because she's recovering from recent major surgery and complications from which she almost died. Today, she is meeting her new primary care physician for the first time. And as she's explaining the details of her unexpected organ failure, the doctor turns away from her and begins to type on the computer. The woman continues to speak about her days in the ICU, her transfusions, her infections. The doctor continues to type, making eye contact only with the screen. Finally, the woman says, "Excuse me, but are you listening?" Startled, the doctor turns around. Yes. This time, that doctor was me. Both of these experiences have stayed with me for many years, heavy on my mind, as reminders of a difficult truth, that far too often, despite our best intentions, doctors do not communicate well. Well, there are many contributing factors to this. One of the most critical reasons that doctors lack communication skills is simply that they were never taught. As a professor of family medicine, I know that our current methods of teaching communication skills to doctors are not enough. Discussions and videos are not enough. We need skill-based training, much like athletes and musicians have exercises and drills. Mnemonics that say E for empathy are not enough. We need to teach the behaviors that enable sincere compassion. Scripted dialogue is not enough. We need to teach flexible skills that enable adaptation to the individual needs of each patient. I believe that the skills of improvisational theater can fill this need. In addition to being a physician, I'm also an improv actor and teacher. I started taking improv classes just for fun, but as I learned how to improvise on stage, improv skills began appearing in other parts of my life, and I discovered that those skills were making me a better communicator, a better doctor, and a better person. Improv theater teaches communication micro skills. For example, how to recognize verbal cues, such as tone or silence, how to use nonverbal cues, such as posture and eye contact, or how to perceive and express a wide range of emotions. Improv teaches how to improve awareness of one's environment, how to remember specific items to use again later, and how to be nimble in thought and action, or how to shift focus in a conversation from one person to another. These are just examples of skills. There are hundreds more. It's actually not about being funny. Humor in improv is simply a welcome and natural byproduct of sincere and skillful communication. Improvisers learn these skills through exercises. For example, a student might be instructed to choose an emotion and then simply say hello to a fellow student while attempting to sincerely convey that emotion. The other student must then respond by attempting to identify and name that emotion and to physically mirror it as well. This exercise continues in multiple rounds with different emotions each time, increasing in complexity as students improve their skills of emotional perception and expression. This is just one example of an exercise. There are hundreds more. Through these exercises, improv can teach physicians how to support their patients and colleagues, how to heighten awareness and observation, how to adapt to unpredictable circumstances, and how to move conversations forward in a constructive way. These abilities are essential to addressing healthcare concerns, such as patient safety, patient satisfaction, medical errors, conflict resolution, and creation of a safe learning and work environment. The communication skills of improv are the same communication skills needed by doctors, so let's teach doctors improv. Medical improv is the adaptation of improv principles and methods to the context of medicine for the purpose of improving communication, well-being, and collaborative patient care. I'm committed to sharing this idea because I'm convinced that this can make a positive difference in people's lives. Picture this: a clinic examination room. A middle-aged woman sits wedged into a chair in the far corner of the room. She appears older than her age. Her hair is thinning, her glasses smudged. She's frowning, she's trembling. Her arms are wrapped around herself. She is my patient, and as I enter the room, she begins to yell. My daughter's dying, my grandson's been abused, they're going to cut the utilities off, my pain is getting worse, and you're not helping, you're making it worse. Finally, she stops, and we sit there in silence. I sit lower in my chair, like she is. I roll my shoulders in, like she is. I look into her eyes and simply say, "You're scared." And quietly, she starts to cry. "Yes," she says. "Yes, I'm scared. All I really needed was someone to listen." Teach doctors improv, and they will be better doctors. Thank you.